Hi, this is Meenakshi Ramesh from tapyourwaytohealing.com. Today is day 6 of the Autism Awareness Month series of videos. In today's video, I just want to share a simple tip if you decide to use tapping with your children. As with any intervention for autism, you as a parent or a caregiver know your child better than anybody else. So as with any other intervention, use tapping with give it a lot of thought before trying it with your child. I would recommend you to just touch the points on your child, just gently touch the points and see how they respond. Because since a lot of children on the spectrum have sensory issues, sensory regulation and dysregulation issues, the mechanical act of tapping in itself can be overstimulating for their nervous system. So if your child is having some kind of sensory disorders, sensory processing disorders, you can just touch and ask them to breathe and see how they respond. And if you feel that they're more calm and relaxed, then maybe you can teach them to gently tap on themselves. And for some children, it's hard to tap. It's hard for them to do tapping by themselves. If that's the case, you can gently tap on the points and see how they're responding. Maybe you can just do one round at a time and observe them. See if there are any subtle shifts, if there is any change in them. Is it getting better or worse? So just observe as with any other intervention, and use your judgment and go for the tapping. Also, it's like sometimes for some children, even tapping once a week is more than enough. Just tapping 5 rounds once a week is more than enough. That's all they can handle sometimes. Sometimes they may need it every day. So you will know, the individual will clearly show you some signs as to whether tapping is helping them or not. So use your judgment and start with the touch and breathe tapping process. I'm also going to post some videos from other practitioners who have recommended some tips for using tapping with children on the spectrum. I'm going to post those videos also. So that's all for today. Keep watching, keep tapping. Bye for now.